Okay, this is to go over some aspects that we haven't discussed before. Let's take a look at hyoid bone. All right, hyoid bone, this is the corpus or body, lesser horns or cornu, greater horns or cornu. Let's turn this around. All right, and what you see here are just the greater horns or cornu of the hyoid bone. Side view, you see again corpus or body, lesser cornu or horn, greater cornu or horn. All right, let's take a look at thyroid cartilage. This is the thyroid cartilage. The front flat surface is the thyroid lamina. All right, this here is the thyroid prominence, also known as the Adam's apple. All right, you see the superior cornu, you see the inferior cornu. Let's turn this around. All right, here you see the inferior cornu, you see the superior cornu. All right. Let's talk about joints of the larynx. You have two pair of mobile joints. The first pair are the cricothyroid joint, which is on both sides, where the inferior cornu meets the cricoid cartilage. So this is the cricothyroid joint. And here, this is the muscle that controls that joint, which is the cricothyroid muscle. Two bellies, all right, pars recta, recta means straight, pars oblique. Let's look at it from a side view. Here is the joint. The joint is mobile, therefore it is diarthrodial. All right, let's take a look at the second pair of joints, and it's hard to see, but essentially they belong to the arytenoid cartilages. All right, when the arytenoid cartilages are sitting on the cricoid cartilage, all right, they are known as the cricoarytenoid joint. All right, cricoarytenoid joint. And these joints are also mobile or diarthrodial. And here you can look at the arytenoid cartilages from above, all right? And this cricoarytenoid joint is responsible for abduction and adduction. And the muscles that move this joint are all of the adductors and the one abductor muscle of the larynx. Okay. Let me look at the film of rigid endoscopy just to give you a little flavor for looking at the larynx through an endoscope. Arytenoid cartilages, all right, piriform sinuses on both sides. This is the laryngeal vestibule. Let me replay that. Remember, the laryngeal vestibule is also known as laryngeal additus or additus laryngis. It is bounded by the epiglottis anteriorly, airy epiglottic folds laterally, and arytenoid cartilages posteriorly. All right, this is the laryngeal additus or additus laryngis and piriform sinuses. Space between the vocal folds is known as the glottis or glottic space. This space at the base of tongue, which is very difficult to see here, is the vallecular space or vallecula. I'll try and give you a little bit better view of that. This is the flexible endoscope. All right, so now we're traversing the nose. All right, this now here is the nasopharynx. Here is the vallecular space or vallecula. All right, let me show that to you again. Vallecula or vallecular space is the space between the base of tongue and the epiglottis, right in here. All right, remember that vallecular space is formed by 3 ligaments and folds, the median glossoepiglottic ligament and 2 lateral glossoepiglottic ligaments. Unfortunately, this will not allow me to stop the proceedings, so let's just go in again. It's formed by the median glossoepiglottic ligament and 2 lateral glossoepiglottic ligaments, and it is the folds, here's the one lateral, all right, it is the folds that we see, and underneath the folds are the ligaments. All right, there's another ligament that you cannot see, but it is the hyoepiglottic ligament, and that is the ligament that goes between the hyoid bone, all right, and the epiglottis. All right, let's just take a look at this flexible view. Before I begin it, this space here, all right, above the true vocal folds is called the laryngeal vestibule. Remember, entrance into. It is bound by the epiglottis anteriorly, the airy epiglottic folds laterally, and the arytenoid cartilages posteriorly. Another name for laryngeal vestibule is additus laryngis, laryngeal additus. This space is the glottic space. These 2 spaces lateral to the larynx are the piriform sinus. You see the concept of adduction and abduction. All right, adduction and abduction. All right, let me just see if there's anything else I need to cover with you. Oh, I want to show you the concept of vibration. All right, we know that the vocal folds are capable of adducting, abducting, and vibrating. And this shows you the vibration effect. Remember, when the vocal folds vibrate, there are 4 phases of vibration: closed, opening, opened, closing. And this shows the 4 phases of vibration very, very well. All right, this shows you the concept of vibration via stroboscopy. All right, let's do a high pitch. In high pitch, you can see that the opened phase predominates. in the low pitch.